I've been meeting with Indians since day one, and we, for the first time, have a senior advisor at HHS who is an Indian and who will be part of every discussion on every issue. And a lot of it has to do with returning power to these communities because they want to help themselves.
Do you see empowering communities way beyond the indigenous community and, expanding it to the entire United States?
I do.
Is this a model for that?
Well, yeah, we all have to start taking responsibility for our own health, and we need incentives. Right now, we have incentives in our health system that incentivize expenditures. So they compensate doctors for ordering more and more tests, and it's a misalignment. We need to realign the incentives so that it's outcome oriented, so that you get compensated if you're a physician for actually making somebody healthy rather than ordering a battery of tests. And that is, some of that is a statutory changes, but and some of it we can do in HHS and in CMS. We're looking for every opportunity to do that, and I think that's what's going to reduce costs and make people healthier.
Have you mapped out a game plan? I would love to see it for doing that. Obviously, you're starting here. This is one of the first places, but have you mapped out a game plan for how this is going to expand and how are you going to roll out making America healthy again?
Yeah, we've mapped out a game plan.
Want to share it?
Well, it's multifaceted. I mean, there's hundreds of things that we have to do. And each of the agencies, NIH needs to have gold standard science and gold standard transparency. We need to replicate studies. We need to publish raw data. We need to get away from the traditional journals, which are controlled by the pharmaceutical industry, and create our own journals, which we're going to do.
You're going to create your own journals.
We're going to create our own journals.
How do you staff those? How do you vet them?
Well, we're going to we have that. We're going to do that. That's going to get done.
So these are the kind of specifics I think people really want to know. I want to know.
Yeah, I mean that'll get done very quickly. And then FDA needs to start regulating food again and saying, not just when food is adulterated, when there's bacteria in it. Let's look at the chemicals in it. Let's stop using the GRAS standard, which we're abolishing, so that.
Right. Generally regarded as safe.
Yeah, which is a standard that was when the FDA was first created. They were charged with regulating food and regulating additives to the food, chemical additives to the food. Congress wanted to allow them. There were some things that were just generally recognized as safe, foods that we'd been using for thousands of years, like yeast and flour and salt and sugar. And so so there was a category created called generally GRAS, or generally recognized as safe, to allow the use of those foods without new testing. But the industry captured the agency, and they began this process where every chemical additive is just automatically stamped generally recognized as safe. That's why we have 10,000 additives in our food in our country, and the Europeans only have 400 in theirs. Because in Europe, a chemical, before it's added to the food, has to be proven safe. In our country, it's just assumed to be safe until proven dangerous.
And supplements, right, are considered as food, and they're regulated as such.
Yeah.
So there's an issue there, right, with trying to figure out,
and I mean, our approach to that is that the supplement has to be what it says it is, and that's our job. That if it says it includes these ingredients, it better have those ingredients and not something else.
Then there are these claims like, probiotics will help your dog, and things like that, and maybe it's exactly what it says is in there, but it doesn't really do what it claims it's going to do.
Right, but I land where people ought to be able to make their own choices and their own assessments. And that the government's job is to make sure that what's in there is supposed to be in there, and maybe give warnings and say we don't believe that claim. Not to be ordering people not to be denying access to a nutrient that because what's happened, the impact is that the government that has been captured. These government agencies have been captured by the industry, so they use that power to deny access in order to increase the profit expectations of the industry rather than actually to protect public health. And we have to understand that dynamic of agency capture is real, it is active, and that we need to have a system that allows people, that respects people's intelligence, that respects people's rights to make their own choices and to make informed choices, and that we give them the best information. We make that available, but if you want to take it, you ought to be able to take it.
That's really interesting to me.
If you want a Coca-Cola,
Yeah.
we know Coke is bad for you.
Right.
Okay, let me say that again. If you want a sugar soda drink, we know sugar soda drinks are bad for you.
Right.
We don't want to deny you the right to take them. You ought to have it right. We ought to maximize choices for people, but then tell them, be very transparent and very honest, and tell them that is going to poison you.
What's interesting about that for me is you're saying, okay, in terms of a public health role for the federal government, you're saying, look, we have access to a ton of information. We're going to look at the information. We're going to analyze it. We're going to say, we think actually this works or it doesn't work or there are some questions. The decision is yours, but here's our recommendation, right? So do you see the federal? You do see the federal government as saying, here's our recommendation.
Exactly. Yeah. Absolutely. The government should be able to say, we don't recommend that you drink soda drinks. We don't recommend that you eat a lot of candy or donuts. If you want to do it, that's up to you. And the same thing should go for for nutraceuticals, or for people who want to go see alternative medicine, who want to do hyperbaric chambers, who want to do stem cells, who want to do chelation therapies. That all ought to be available here in the United States for people who want them. You're going to have quacks, you're going to have charlatans, and the federal government can keep their eye on that, and they can make recommendations, but it's got to be up to individual choice.
It's really interesting to me, and I know we're running out of time, but it's really interesting to me that you're saying that there's a role for the federal government to say, look, we're going to look at all the data. We have access to information you probably don't even have. And we're going to look at it all. We're going to talk to scientists.
We're going to post it all.
And you're going to post it all, and you say, and at the end of churning and compiling all this information, here's what we think. Now it's up to you what you do.
Exactly. That's the role that the government should have.
Anything else you want to say about this place?
I went through all of these different commodities, and I read the ingredients, and it's this is all made on all of these different grains are grown locally on Indian land, and all of them, none of them have seed oils in them, none of them have borate, none of them have titanium dioxide. None of them have any ingredients that you can't read.
I can't believe you were able to read these ingredients. How are your eyes?
I had to wear my glasses.
And you know what? Now, one ingredient is an ingredient that my grandmother would not recognize.
Exactly.
Well, thank you so much.
Thank you
for
very
the
much,
time.
Dr. LaPook.
Really appreciate it.